My name is Dr. Bal. I'm a family physician in Cambridge. And during COVID, I've been part of the community response with Waterloo, Wellington, and Ontario Health West. And I'm also part of the vaccine task force for the region of Waterloo as the primary care physician lead. And it has been a very, very difficult year for so many. And I can speak specifically for me. One of the highlights for me of this past year was when I was called into Grand River Hospital and told that I would be getting my vaccine. And I've had both my doses, and they've gone great, and I tolerated them really well. And why did I choose to get vaccinated? Because it's going to keep me safe. It's going to keep my family safe, and it's going to keep my patients, those in long term care homes, and those I see in the office, safe. As a family physician, one of the most common questions I get is actually not about how effective the vaccine is. People seem to think that all of the vaccines are quite good. It's really about their hesitancy about the speed at which they were approved. And that's like a really good question. So I think what I would communicate and what I've told my patients is that the science and the size and the recruitment and the trials themselves were conducted just the same as they would be for any vaccines. The difference is the time between the different stages and phases of research. That's typically months and years to secure funding. But with COVID, with the amount of international effort and investment, that space between those phases became so small. And so it's not that the research was compromised in any way, it's just that the system operated the way it should for these types of trials, and it wasn't unnecessarily delayed. The other thing is because there's so much COVID, it was so prevalent, the placebo arm, those folks got sick quite quickly. And that also advanced the ability to get the vaccine out sooner. Another common question that we get is because this is an mRNA vaccine, the Pfizer and the Moderna, can they change our DNA? And that's a great question. And the answer is absolutely unequivocally no. The way you can think of these vaccines is basically they're a messenger, a bit of a code that asks the body to make something called a spike protein. The spike protein is the very special part of the COVID virus that makes it different. Building spike protein cannot give you the virus, it cannot give you COVID. And the actual messenger RNA, the little code, that is actually kind of like a post it note. It gives you some information, us as our body, our cells, some information. We look at that and we say, thank you very much. And then it just disintegrates after a few days. It doesn't enter our DNA and it doesn't affect it in any way. I know it can feel very difficult when you may not be eligible for a vaccine, maybe in the next few weeks or even few months. But it's important to know that all of us, whether we're vaccinated or not, should still be following good public health guidance because that will keep us safe while you wait for the vaccine and wait for others to get vaccinated. So that means washing your hands, that means physically distancing, wearing your mask. And as more and more people get vaccinated, we'll get more and more advice from our public health experts. And I know it can be hard. My little nephew, Jordan, was born in the US last August, and I still haven't seen him. And my parents are waiting for their vaccines patiently in Acton. They're in their mid 70s, and I haven't seen them for almost a year. But all of us have faith in the fact that there is hope on the horizon. So that's why I would encourage all of you to get vaccinated when it's your chance. Remember, protect yourself, protect others, and get vaccinated.